Today we are to here together, Father. Good morning, one and all. Today we are gather for the presentation of new topic. Wait for another 2 minutes while all the participants are joined to here for pharmacy practice class. Just 29 participants are registered out of 106 or 7 something. Once reached to the 50, we have to start the today's session with sharing of this my slide. Next subunit of unit 2, that is patient's medication history interview. How to collect the patient's history, collection methods, and what is the goal, what is the importance of this patient medication history. We have to study here. Along with one of the forms which is required to maintain the patient's history. Whatever the drugs are prescribed earlier, whatever prescribed currently, recently by the particular physicians, or more than one physician prescribe the particular medicaments. That medication history was preserved for their benefits, patient benefits, or patient's wellness. Within 2 minutes, we have to start the sessions related with the patient's medications history interviews. As per your syllabus is concerned, there are only definitions and need of this patient medication history interviews and medication history forms. Which type of forms preserve the information related with the patients? Whatever the medicaments are given by the concerned physicians, taken by the concerned patients for treatment purpose, for wellness purpose. Now we have to start with the sessions, patients, medications, history interviews. As per your syllabus contains only the need for the patient's medication history interview and medication interview forms. These are the only contents which is given in your syllabus. What is the need and what is the forms? Only two things. Apart from general categorize is a definition of patient's medication history interviews. All of you visible my screen? From this presentation or from this class, you have to know about the patient's medication history interview and their importance for the management of patients' detailed information related with the medicaments earlier prescribed or recently prescribed by the different physicians, and also maintain the record of vaccinations of concerned patients in this medication history. These things you have to learn after completion of this subunit. And also you have to know the various forms which are required to maintain or preserve the data of that particular medication of particular patients, which is help to obtain the complete informations and avoid the omissions. Unnecessary, unwanted medicaments you have to avoid it if complete medication history is collected, was collected. These things you have to learn after finishing the patient's medication history interview. In this segment, we have to outline of this content of patient's medications history interview. First, we have to taken care about the definition of medication history interviews, which type of goals we have achieved in medication history interview, the importance of this medication histories, and what to be documented procedures, and the whatever the interviews, they collection the information related with the medicament of patients. There are various sources we have to follow or get the informations of the particular patient's history from information sources, some questions to ask particular patients, and some tips which is helpful to take the correct information related with the patient's history, and some other questions, some cards you have to maintain the medication history. In the cards, which type of informations are various type of information should be recorded and preserved for the patients, and which is useful for the future prospectus, and some documentation. These are the information we have to study in this segment. So we have to move with the first. What is medication history? Interview. This medication history, first of all, we have to see with the medication history. What is medication history? History means complete account related with the medicaments. Which type of medicaments? Which is prescribed to the particular patients. That informations are collected, detailed, accurate, and complete account of all prescribed and non-prescribed medications that a patient had taken or is currently taken prior to a newly initiated institutionals or ambulatory cares. This is called as medication history. Nothing but it's a detailed account related with the prescribed medicaments as well as non-prescribed medicaments. That is called as medication history. It provides valuable insight into the patient's allergic to the particular medicaments, adherence to the pharmacological and non-pharmacological treatment to the concerned drug by concerned patients, probable self-medications also involved in the medication history with complementary and alternative medicines. Apart from the allopathic, some Ayurvedic, homeopathic medicaments, if taken by the particular patients, that information you have to collect it as a medication and history. And what is called as medication history interview? For collection of this data, take the interview. That interview of patients called as medication history interview. Means collection of all medical history from patient. That interview is called as medication history interview. In short, what is the goal of this medication history interview? What is the goal? To obtain the all information related to drugs that may assist in overall care of particular patients. Means major goal or one of the goal of this medication history interview collections is to obtain the all information related to the medications given by the particular patients. Why? To care the particular patient, overall care of the patients. Means particular patients are suffering from allergy to the particular drugs. For example, penicillins. Penicillin drug gives the allergy to the particular patient. So, if particular physicians are know about the medication history of patients, so particular drugs are avoided during the medicaments to the particular patients. So this information is gathered and utilized for the medication to the newer disease. This information is this information gathered which is used for during investigation and dispensing of the medicaments as per the records, medication records are collected. Verify medication history taken by other staffs that provides additional information whenever required. Document related with the adverse reactions and allergic to the particular medicaments that should be noted in this medication history entry. And this adverse reactions to the particular drugs which is useful during the prescriptions by the physicians. Screen for drug interactions also help on assess patients medication compliances. Yes, with the help of this history, whatever the compliance related to the medicaments that can be assessed to the particular physicians. Assess the rationale for drug prescribes. Assess the evidence of drug abuse. Appearance the drug administration techniques. Examine the need for medication aids. And finally, documentation, patient initiated medication administrations. That, that information or that type of goals are achieved by medication history entry. The importance of accurate drug history is preventing the prescription errors. If accurate information is gathered through interview, medication drug patient's medication history interview to avoid or prevent the prescription error by the physicians and reduces the risk, prevention of the risk to the particular patients due to the available of medication history. Apart from preventing prescription errors and accurate medication history, also useful in detection drug-related pathology or changes in the clinical signs that may help during the result of particular therapy of drug. Is only not prevention of the prescription error, it also detect for the drug-related pathology with the help of this medication history. A good medication history should encompass all currently and recently prescribed drugs, previous ADRs, that is adverse drug reaction, including some hypersensitivity to the particular drugs, hypersensitivity reactions, over-the-counter medications, also enter into the medical history, including herbal as well as alternative medicines like homeopathic, Unani medicines, that also be counted during the medication history and also adhere the therapy for the better healthcare plan with the help of this history. We have to give the better healthcare plan for the particular patients. This full medication history is identify the patient's need, explore the patient's perspective of illness and its treatments is useful only possible due to the full medication history. Identify the patient's needs, what required, what not required particular patients, that identifications from complete medication history and explore the patient's prospective illness and its treatments from this medication history, complete medication history. For medication entry, what to be documented? Means in medication, history, what type of document we have to cover, which is suitable for the identification to the particular pharmacist, particular physicians, particular nurse of concern hospitals from this medication history. To review current medical treatment and identify suitable additional treatments. Medical professionals will require complete and reliable medication history. Research has established that in routine practice, and for that, pharmacist is gives most accurate history when compared to the other healthcare professionals. So the pharmacists have an important role for gathering the medication history of patients. For documentation purpose, a well-prepared structure approach helps to obtain the particular relevant informations and avoid the omissions from the patients. So, for collection of documentations, the structure, well-planned structure is available. If available, it is good for the complete collection of the history of particular patients related to the medicaments. Following parameters or information generally recorded as a common to all. That is currently or recently prescribed medications by the concerned physicians. What are the medications we are consuming currently? That that should be commonly recorded firstly. Then OTC medications, for examples, when you go to the medical store, generally we have to ask if we are suffering from the fever, we are asked for paracetamol only or Clocid or Dolo. These are the brands of paracetamols. These are the some OTC medications also taken consideration during the collection of the history. Vaccination programs from birth to the till time. What type of vaccinations, which types of vaccination you have to cover. That information commonly recorded in the history. Generally, vaccination chart should be available with each child when, when they are birth to the till date. Whatever the vaccinations programs carried out over there that are recorded as a vaccination card. Alternative or traditional remedies, if taken by the patients, that can be measures or accountables during collection of the history medications. A description of reactions and allergies to the particular medicines. If particular patients suffer from allergy to the particular drugs, that should be noted or notified by the concerned patient to the pharmacist or information collector towards the information collectors. Some of the medicines is ineffective to particular patients that can be identified during this process and adhering to the past treatment. These are the commonly information generally recorded in the medication history. This is general form of patient's medication history. It contains patient name, particular patients allergic to the particular drugs. If allergic to the patient to the particular substance or particular drugs, then tick or check the particular checkbox and write down the type of reactions. What type of action was carried out after taking the particular drugs and gives the allergic. Means particular drugs or some allergies, dust allergies, photosensitivity allergy, that type of allergy noted from patient to the particular medication history forms. हे स्क्रीनशॉट काढून ठेवायचं ठेवा किंवा नेटवर अवेलेबल आहे कुठलाही फॉर्म वापरू शकता जनरली In the medication history forms, these are the parameters are included, like allergy, particular allergy, you have to mention particular types. Then if female patient is a, then related the information with their pregnancy, you have to note it in the history forms. Current medications, particular prescription currently prescribed by the physicians, that medications are noted here along with the strength of particular drugs in the form of tablet, in the form of dosage forms you have to note it, and whatever the directions given by the physicians, means BID dose, TID dose, before the meal, after the meals, whatever the directions given by the physicians related to the particular medicaments, that should be noted in these forms along with which doctor prescribe particular prescription, name of the particular physicians here, either a specialist, either general practitioners, either family physicians. That name you have to note it here. Another is OTC drugs, over-the-counter medications if taken currently. Then take the checkbox particular and write down the which medicaments consumed OTC along with their strength and which directions, which type of directions given by the pharmacist during taken the OTC medicaments. Apart from this OTC medicaments, some alternative medicines. Apart from allopathic, some Ayurvedic, Unani, homeopathic medicaments, if taken, then you have to write down here in this form, along with their strength and the directions. And finally, which pharmacy give this information form, medication history forms. Name of the pharmacy, their phone numbers, and medication list renew. All of you take this screenshot related with these forms, because as far as syllabus is concerned, patient's medication history form, which type of form, which type of information is required in that particular form. Another form is available in these forms. Medication name means name of the drug along with their strength, how much quantity they are taken, how much quantity, frequency of that particular drugs, means BID, TID, for how many days here you have to written in this format, date, started date and stopped date, particular drugs, reason for taking, and who is the prescribers. This is a general format where particular medications taken as per the guidelines of physicians. And this is a complete medication history form. You have to take the screenshot and memorize which points you have to cover during the medication history form. And this record is on which date this record is created for particular patients, that created date, and who is the creator, means pharmacy, generally community pharmacy, and generally create this type of medication history forms and collect the information, necessary informations. This is the simplest form where the which type of only addition of the medicaments. For collection of the in a history, you have to take the interviews for the collections. Here client is the patient, interviewing the client. Client is the patient's During interviewing, firstly, you have to introduce yourself. These are general things. Generally, you have to carry it out during the collection of the informations. Introduce yourself, inform client of reason for you being there. Means why you are here, give the reasons to the particular patients. Here client is treated as the patients. Inform client of importance of maintaining a current medication list in your chart or in your medication history forms. How will you collect the information? Through various sources, information source. That is, first is patient, no doubt. This is information related to patients. So the patient is essential. If patient undergo serious conditions like coma-like conditions, then their family members are involved for giving the informations. Medications, which type of medications in the form of vials or bubble packs, medication list, means whatever the information you have to collect it from patients, either from patients' family members, either the medications vial containing necessary information related to that information you have to collect it. Medication list is which medications given by the physician to the particular patients. From that list, you have to take the necessary information from necessary information for their particular patients. Through community pharmacy, you have to collect the information related to the medicaments. Means particular persons they have to come and know about my family members taken the Corex. Corex is the brand of narcotics medicaments. So that type of habit should be available with my family member or not. That should be checked with the help of this community pharmacy. Medication profile form and drug program information network. From these sources, you have to collect the necessary informations. ठीक आहे, आज इथपर्यंत घेऊया आणि पुढे 15 ते 20 मिनिटात पुढला सेशन आहे. आता घ्यायला काही कंटिन्यू करायला काही प्रॉब्लेम नाही, पण सेशन संपेल आता झूमचा. ऑलमोस्ट only 3 minutes, 3 to 4 minutes are remains.
Hello, sir.
बोला. बोला. अजून एक सांगायचंय मला, ऐकू आले का? हॅलो, अजून एक सांगायचंय.
हो सर, ऐकवले, सांगा.
सेशनल एक्झाम 5 तारखेपासून आहे तुमच्या. फर्स्ट सेशनल आहेत का? आहेत ना? कशा प्रकारे? ऑनलाईन पद्धतीने आहेत ना? हॅलो, एक्झाम कशी होणार आहे ते सांगितले त्या नोटीस मध्ये?
एमसीक्यू
पॅटर्न, मल्टिपल चॉईस क्वेश्चन्स. मग आपण एमसीक्यू घ्यायचे काय घ्यायचे? शैलेश,
काय सर?
एमसीक्यू घ्यायचेत ना? तुम्हाला थोडं टास्क देऊ का पहिल्या 2 चॅप्टरचे एमसीक्यू माझ्याकडे पाठवण्यासाठी सगळ्यांना?
काय सर?
एमसीक्यू मल्टिपल चॉईस क्वेश्चन जे आहेत ते आपले तयार पण होतील आणि तुम्हाला सर्क्युलेट पण करता येतील. जेवढे काही सब युनिट क्वेश्चन नंबर आपल्या युनिट नंबर 1 आणि 2 मध्ये असतील त्याचे प्रत्येकाने 2-2 जरी पाठवून दिले सब युनिट मधून, तर जवळपास 60-70 एमसीक्यूज तयार होतील. त्यातलेच मला टाकायला सोपं जाईल एमसीक्यूज तुमच्यासाठी. का मला नको? तुम्ही दिलं तर टाकेल, अदरवाईज माझ्या मी तर प्रिपेअर करावंच लागणार आहे मला, त्यात काही प्रॉब्लेम नाही. तुम्ही केलं तर तुम्हाला
आम्ही
सर्क्युलेशनला
देतो.
सोपं जाईल. तर तुम्ही डिस्कस करा फायनल इयर मध्ये सध्याचे करंट, आणि कोणाकडे तरी इन्फॉर्मेशन गॅदर करा, सगळे एमसीक्यूज ऑलमोस्ट 60-70 एमसीक्यूज व्हावेत कमीत कमी, त्यातलेच 15 मी टाकेल मग. चालेल का?
हो सर.
तुम्ही सर्क्युलेट करा, ग्रुप करा वाटल्यास, आणि मल्टिपल चॉईस क्वेश्चन्स 60 तरी कमीत कमी असावे, जेणेकरून मलाही ऑप्शन राहील टाकण्यासाठी आणि तुम्हालाही राहील थोडासा अभ्यास करायला एक्झाम पॉइंट ऑफ व्ह्यू. चालेल का? तर कधीपर्यंत देताल युनिट 1 आणि युनिट 2? युनिट 2 मध्ये 6 सब युनिट आहेत, आपले 3 झालेले आहेत, अजून 3 होतील, 2 तर 100% होतील, एखादा राहील 1 आवरचा, ते मी शनिवारी वगैरे एक्स्ट्रा घेऊन संपेल. म्हणजे फर्स्ट 2 टॉपिक्स तुमच्या सेशनलला असतील. युनिट 1 hospitals and its organizations, community pharmacy, etc. ADS. And unit 2 hospital formulary, आजचा एक मेडिकेशन हिस्ट्री इंटरव्ह्यू, मागं झालेला एक कुठला झाला हो, हॉस्पिटल फॉर्मलरी, कुठला झालता हो? हा, ड्रग डिस्ट्रीब्युशन सिस्टम इन हॉस्पिटल. सध्या 3 झालेले आहेत, अजून 3 बाकी आहेत. थेरापेटिक ड्रग मॉनिटरिंग, ऑलमोस्ट therapeutic drug monitoring, you have to little bit information or maximum information you have to study in pharmacology maximum. That things you have to repeat it here. Then medication adherence and community pharmacy management. हे 3 सब युनिट अजून आहेत, ते संपतील पुढल्या आठवड्यापर्यंत. Hardly 1 to 2 hours lectures required maximum for remaining sub unit. Maximum next Saturday unit 2 is completed, and this unit 1 and unit 2 is a syllabus for seasonal examinations. So सगळ्यांनी मिळून नियर अबाउट 105-110 जण आहेत, सगळ्यांनी जर 2-2 जर काढले तर 220 होतील क्वेश्चन्स. तर तुम्ही डिवाइड करून मला कसं करता बघा, कोण घेते रिस्पॉन्सिबिलिटी, फर्स्ट 50 मधून कोण घेईल आणि नेक्स्ट 50 मधून कोण घेईल कलेक्शन. दोघं जण मिळून कलेक्ट करून द्या मला. कोण आहे रोल नंबर 50 पर्यंत? आज किती तारीख आहे?
प्रद्युम.
हा, 22 तारीख आहे आज, 21?
22.
तर
हो सर.
22 नंबर जो शेवटी येईल, 3022 म्हणा किंवा 4022, त्याने फर्स्ट 50 ची रिस्पॉन्सिबली गेली. 22 आणि 9 मल्टिप्लाय करा किंवा 3 न मल्टिप्लाय करा, 66 होईल. 66. 22 नंबर कोण आहे? अनम्यूट करून मला यस सर म्हणा. 22 नंबर कोण आहे?
यस सर.
कोण आहे? गिरी. पहिले
सर
50 एमसीक्यूज पहिले 50 जणांकडनं कलेक्ट करून तुम्ही घेणे रिलेटेड विथ द युनिट 1 मेजॉरिटी. 40
ठीक आहे सर.
40 क्वेश्चन कमीत कमी काढा युनिट 1 मधून.